Hi, I'm Doc Jenny. Join us in the Green Hornet as we travel the back roads of beautiful North Idaho. Every day is different, challenging, and never boring as we see all the farm animals, big and small. Hey, you're on the road with Dr. Jenny in the Green Hornet. Today we're going to talk a little bit about breeding. As a breeding specialist, I do a lot of reproductive work, and creating nice young horses for future generations is a big part of the reason I love to do veterinary medicine. I love to see the babies in the spring and create the new babies and work with the foals and work with the stallions as well. I get asked all the time about if someone should breed their horse, why they should breed, and what's involved in it. Taking on breeding of a horse, or any species, is not to be taken lightly. It definitely is a big responsibility for the owner of the horse to make sure that not only is the young foal and offspring going to have a good home to be going on with, but that they're also going to be well taken care of, and that you're willing to take on the risks that are associated, especially with breeding a mare. In order to breed a mare, she needs to be healthy. It helps if she's of a younger age. I like to see my young brood mares between the age of 4, and if it's a maiden mare, I don't like to see them any older than 12. And those mares will carry a foal for an entire year, and so their health, and they need to be healthy and able to carry that foal without any complications through that entire gestation of, it's almost a year, it's 11 months in a horse. So there's a whole bunch of things to take into consideration before you decide to breed your mare. The health is just the first part. Also, are you creating a foal that's going to have a marketable use into the future? So you may love your mare, you may think she's the best mare on the planet, but creating a horse that may or may not be marketable for the future is only going to overflow our stockyards and sale yards in the future as well. We do have an excess number of horses that we have in the stockyards, and so making sure that that horse is going to have a marketability for a use is important going into the future. So choose the crosses for your horses wisely. Talk to your veterinarian, talk to people who are in the discipline that you're involved in, and make sure that you're not just breeding to whatever stallion is down the road and available. Take into consideration the cross that you're creating and make sure that that horse is going to have productivity into the future. And then the other side to take into consideration is that there is definitely a risk associated with breeding your horse. I don't like to scare people, but there's all kinds of things that can and do go wrong. Along with the miracle of birth that we experience every spring, there's also the realities of birthings that don't go well. And those are always part of the tragedy and part of the reality of running a breeding operation. So we like to make sure that everyone is aware of those before they go into breeding. Today we're going to be working with a stallion, an Irish draught stallion. He's being bred to a mare who is a little bit too big for him. And so we'll be collecting him and putting that semen raw into the mare for collection. We already checked her to make sure that she was ready and able to be bred. And so now we'll be handling the stallion and trying to create another baby. And this particular broodmare has already had several foals, so we're looking forward to seeing what this cross brings in the future. So we're back again talking about this potential broodmare that is a candidate for breeding to a appendix quarter horse stud in preparation to make a performance horse, specifically a barrel or a gymkhana horse. So she's a nice mare. She's got good conformation everywhere except for this front foot. So I don't know the history of this mare. I haven't talked to the owners of this mare as of yet, but she definitely has an abnormally turned foot with some swelling of the pastern joint here. Looks like she has possibly an arthrodesis where the joints have fused together. This may also be low ring bone, and if you look at the front of her leg, you can see how it's got a pretty good curvature to it. She has some scars here. This is possibly an injury. It'd be nice to know any of that before we really start looking for her as a broodmare, because if this is genetic, there's a possibility of passing that on as well. So those are definitely things to take into consideration before you breed your mare. You know, it's a risk every time that you may have something undesirable show up, because every cross is a crapshoot, basically. But knowing that we have an abnormality such as this, I would usually caution an owner if this is something she was born with that could potentially pass it on to the foal, And then that just increases the number of unwanted horses or unusable horses that we have out there. So the old adage of, well, if you have a mare and she goes lame, at least you can always breed her. Those probably aren't the mares that we necessarily need to be breeding, especially if it's a congenital malformation that predisposes them to becoming lame. So, but we're gonna check this mare out. They have bred her once and she did not settle and she has not recycled. So we're gonna do an exam on her and see if we can figure out why she's not cycling and see if we can get her ready to be bred. But this definitely is a concern as far as that leg and that lameness on this mare. Little sister. Because I am on the road so much, I rarely have stocks to work on these mares in. So the mares need to be good for palpation, just standing here in the aisle or in their stall. Most of the time, if you just go slow with them, most mares are gonna be just fine. Every once in a while we run into one that needs a little bit of sedation in order to get through her first one. And then after that, they're usually pretty good about it. And while it's a little bit uncomfortable and surprising for them, I don't think it's necessarily painful. Obviously, it's not painful or they wouldn't get good about us doing it. So because this mare is new to me, I'm just taking it slow. Because I'm gonna ultrasound her, I have to take all the manure out first because I can't see around the manure. So I've got to clean her out first. Okay, so their main concern with this mare, other than the fact that she didn't settle, was that she hadn't started recycling yet either. I do have multiple small follicles on the right ovary. All of these circles here are a fluid-filled follicle, and the mare will develop these in waves. So she's got several, nothing dominant. Then we're following down the uterus. This is the cross-section of the uterus here. And now we're over. I have to sweep over to the left ovary. And this means that they missed an ovulation. So that is a great big corpus luteum. It actually doesn't look like it's very old. I still have just a little bit of fluid in the middle of it, which is pretty typical of a corpus luteum that is less than 3 or 4 days old. So it's not completely homogenized yet. So it looks like this mare was just in heat. With that into consideration, my recommendation would be, if they'd like to get her bred this month, is that we allow that corpus luteum the time to mature, which usually takes about 7 days. And then we can, what's called short cycling her, we can give her a shot of a drug called estromate, which will get rid of the corpus luteum, and then she should come back into heat. So that'll be our plan for her, but I am gonna talk to the owners about that front leg as well. So they were concerned that she maybe had some cysts in her ovary or something along those lines, but I definitely don't see anything that looks like a cyst. It all looks pretty normal, and it looks like she ovulated normally. So from here on out, we get her cycling again, wait for a follicle to mature, and then she can be exposed to the stallion. Hey everybody, thanks for riding with us in the Green Hornet today. This is Doc Jenny signing out. If you like what you saw, be sure and follow us in the Green Hornet with Tormund, out on the road with Doc Jenny. Just click the link below and follow us along on our journeys. See you later.